Well, welcome everyone to Pet's Best Friend. Yes, you heard me correctly. It's Pet's Best Friend. We're bringing back the most popular show we had. Well, the second most popular show. The most popular show is the Sam Lesante show. My good friend, my adopted brother, Anaya Kathio, is here, Dr. Anaya Kathio. And folks, we're going to be bringing the show back. We had a lot of people. I don't think a week goes by that people ask me, when are you bringing this pet show back? When are you bringing the pet show back? Particularly now that anyone could see this in the entire world. And you can see it 24/7. My good friend Anaya Kathio. Doctor, how are you?
Sam, thank you very much, baby brother, and good to see you again on the stage, and thank you for having me here. We have lots of information accumulated over years to show to the people how they take care of their pets.
Well, it's been a few years, right? I think,
yes.
Okay, but let me just share this with you personally, and I'll explain to you why why I could not do the show. As you know, I had a dear pet, Samson, Bijan, who was like, as you know, if you have a pet, was like family to us. And this good doctor kept him alive, 4 or 5 years longer than what he should have lived. And when he passed, it was devastating to me and my wife and the family. I just could not put myself together to do the show. And I guess that's a lousy excuse, but it just every time I would do it, in fact, it's emotional even as I speak to it. You lose something. And this guy was so great in comforting. I think probably the hardest thing he had to tell us was when he had to tell us about Samson and how bad he was. And I'll never forget that day as long as I live. And when you came in and said, you got to give us, those must be times that you certainly don't like.
Sometimes it's very difficult, and our Sam, they had developed bad liver cancer, and you can see even in human beings, they can do so much to survive. Again, it's very sad, to lose the pet. It is very sad, it's a part of the family members now.
Well, and you know that well.
Yes,
okay.
I know.
But we're moving on. Things are happening, and I'll share some good news with you maybe next month. Okay, we have some things happening. But first of all, when we talk about veterinarian medicine, which is so critical today, a little bit of why it is so important. First of all, some people who buy pets, okay?
Yes.
I know we've talked about this before, but just to revisit this, when someone's thinking of buying a pet, what should they be thinking about? What should they be doing?
First of all, let's see why people buy the pets. They see a little cuddly animals, and they just fall in love with them. And of course, I don't blame them. And they go and buy that pet and bring it home. When they come home, then they start learning what has to be done. And that should have been thought before. We are buying an animal, needs feeding, waters, taking down to the veterinarians, taking down to the groomers, and needs attention, because animals can get depressed, they get anxiety, and sometimes they come home and they find out that all furniture is chewed up or something, because they were lonely for so long, they were mad, but always, pets, when you come home, they greet you, that if you're so tired, you see them greeting you or something, it takes your fatigue away. So learn before you buy a pet, because there are many responsibilities that you have to understand. You have to clean after them, you have to walk them, you have to give them attention. They are not an inanimate object. You can bring them down and keep them like furniture, and once in a while you dust them and forget about it. They require lots of attention.
There are a lot of people that have pets, okay, as you see them every day in your office. Again, the proper care, all right, I guess like we have to go to at least a medical doctor once a year to get a good physical. Yeah. We go to the dentist, get our teeth cleaned or get our teeth checked. Animals are very important, that you should be taking care of them. And what is the rule of thumb in taking care of either cats, dogs, or whatever?
The rule of thumb is the common sense. Like if you bring the animals, most of the time people bring the animal when they are like puppies or kittens or baby birds or even snakes, your favorite pet.
I hate snakes, you know that.
Your favorite pets, you know. They have to learn to puppy-proof their houses. They have to learn, if we have exotic animals, you have to know their husbandry. puppy proofing, because these puppies can come home and get into things, then swallow the objects. You will see some of the surgical procedure I would show you later on as we go on. Another thing, when they bring some exotic animals that do not know anything about their husbandry, their diet, they start getting problems. And some of the animals, they bring it down, like we have a bird on this show, is a canary. They bought it 4 years ago. The bird's legs were so messed up, they thought they were normal. But when they come to me and they ask me why the legs look like that in this bird, I told them the legs are diseased, and there is a culprit, a mite that is sucking up on the serum from the legs, and he's feeding on the legs. That's why the legs look scaly, and they look distorted, and they look weird. I did the procedure. We will watch on this show, and I educated the person, and sometimes it's very difficult to comprehend what's going on with these animals. I had another animal we will see on the show that was urinating over and over and over again, and some people think it might be normal for small animals to do that. Like a bird can go every 15 minutes, but if the dog goes every 15 minutes, it's a problem. In this particular dog, we examined it. When I was doing the examination, I found this dog, which was Bichon Frise, had a pain in the abdomen. Then I palpated some lumps in the urinary bladder area. I did ultrasound on him, and it was positive for stones. And then I did, of course, X-ray and found out I had 2 stones. We will watch on this show. We performed the laser surgical procedure. Now this dog was also bleeding like in the urine. So there was also like getting anemic. Now, got to the point where dog was so listless or something, and we have to perform the.
And we'll see those 3 surgeries after we come after break. So taking care, you said common sense. At least once a year, you should bring the dog to the vet.
I would say every 6 months, if
every
not
6 months.
Once a year. Another field that is ignored is a dental problem in the dogs and cats. And people think you go to the doctor and get the teeth cleaned only once, they are good for the life. No, every 6 months you have to take your pets, especially ancient like me, and every 6 months you have the teeth cleaned.
One other thing before we're going to come, when we come back at the break, we'll show we'll show those 3 surgeries you're talking about. A lot of people ask me when they see me, Dr. Kathio, tell me a little bit about Dr. Kathio, okay? Who is he? What does he do? Now, many people know you, okay? You have a very famous name and a good reputation, as well as, you get some good press. The Standard Speaker did this article on you. We did the news story on you, which I'll talk about, folks, a little bit when we come back. But a little bit about you, Doc, your background.
My background is I was born in a small village in Pakistan. It was very difficult to live in that part of the world, and I have like 3 brothers and 4 sisters, big family, and my older brother and sister, they died when they were young because we didn't have the pox vaccinations. I'm living because of America. I'm very thankful to the American Red Cross in America. They were there in Pakistan for me when I was a child. They gave me the smallpox vaccination, and I survived. I'm very thankful to the America. People in that part of the world, where I come from, it's very hard that, even getting a food for a day. I did my education in Pakistan, primary and secondary education in Pakistan. I graduated from the Agriculture University in Tandojam, Pakistan. We have to learn about animals. They produce meat, milk, and egg. And we, of course, have to learn about the dogs, cats, birds, poultry, exotic animals. So I had a wide experience of, I had many more subjects than I see in the curriculum in an American school. I got a job with the government. I was a high officer in the government of Pakistan. Then I was selected by the government of Pakistan to join the United Nations Development Program and the Food and Agriculture Organization of the United Nations. Then the United Nations called me here in Washington, D.C. And also they were kind enough to give me the fellowship. I did a fellowship in Georgetown University, Washington, D.C., Iowa State University, and University of Missouri. And I have a good contacts with the University, Cornell University, New York, which is a fabulous university worldwide. I get there my continuing education courses. And also, I'm a consultant. Currently, I'm also consultant with the United Nations, and I work closely with the embassies of the world to give them some kind of knowledge and gain some kind of knowledge and disseminate this knowledge in the developing countries.
And folks, I also want to tell you, and he could probably spend 4 hours on his background, but he also goes into Italy and goes into Jerusalem, goes into Pakistan. He has a couple of veterinary hospitals in Pakistan. But when he goes there, he teaches them how to, in one case, the neutering, there's certain diseases, etc. He brings a lot of education to a lot of people throughout the country, as well as the world, at no charge. Okay, folks, at no charge. We come back, I want to talk a little bit about this article that's in the Standard Speaker, plus the news article we did on this cat that we shot. Then we have those surgeries we want to show you, and it's quite interesting. I'm really excited about bringing Pet's Best Friend back. We'll be back right after this. Well, welcome back to Pet's Best Friend. I'm Sam Lesante. Of course, the main star here is Dr. Kathio. Folks, if you would like to contact Dr. Kathio, 655-2412. Very easy number, 570-655-2412. But before we do that, this show is brought to you in part by Tom Bickett, Pure Mountain Spring Water, folks, the official water of SSP TV and Samson Productions. Starbucks use this water, folks. If they don't have this water where you buy water, ask for it, okay? And also, folks, many of you have been asking me, you take the omega-3s, the PRN, Lifeguard omega-3s every day, but I also use Monavi, okay? Monavi, this is fantastic stuff. I take 2 shots in the morning. Pasala Enterprises, 455-2900 is the phone number, 455-2900. This stuff is great, folks. You should start trying this stuff. It's stuff I take in the morning. Make sure I could run a marathon, maybe half a marathon.
Yeah, I get the holy water.
You get the holy water? Okay.
Yes.
Folks, article in the Standard Speaker. We had this article. We had a big news story. Nikki Kreis went out. As you heard this, someone shot a cat. Barbara Winkler's cat. Shot the cat, called him in the night after our news story was on. My wife spoke to, had arranged everything, talked to Dr. Kathio, called Barbara up. Here he is. He's done at 8:30 at night, drives up from Pittston, goes into McAdoo, gets the cat, takes care of the cat for nothing, no charge. And then on top of it, which shocked me, it says, he was so upset to see this and trying to save this cat, he's offering $1,000 for anyone who could give us the information who shot the cat. And the Standard Speaker did an excellent article. As you know, there are media partners, Who Shot Sissy, a very nice article. All I can say to you, Doc, is, once again, I've seen this happen in your place many, many times, so it's no stranger to me.
It was very sad to see when I went there and cat was just laying there and was ready to, like waiting for the death to come so she can pass away or something. I was, as I said, I was called at 8:30. I arrived there at 9:30. I asked the people, what happened. They gave me all the story. The cat was shot from the left arm. The bullet went through, broke the bone and severed all the nerves and blood vessels. And they enter into the chest, damage the cranial parts of the chest, lungs, and exited from the right side of the arm and damaged the right arms and the nerves. So the cat has no use for the front both legs. And when I took the radiograph and did the blood test on it, and the blood test was the white count was sky high. It was very high because the cat was there for 2 days before I was informed that I have to treat the cat.
Well, Debbie saw that on our news,
Yeah.
and as soon as she saw that,
Exactly.
she felt, so that, we didn't know about it until we had it on a news story.
Oh, yeah.
And, but then go ahead.
Yeah, then I brought the cat down from McAdoo, which is 45 miles away from my place, and put the cat on intravenous because cat was quite dehydrated for those 2 days. Gave her the oxygen so lungs, can have some assistance. It is better than the room air. I then gave the local anesthesia to the cat because the cat could not take the general anesthesia. And when I was cleaning, when I was cleaning the wound, I found out there were about 25 maggots. They were into the wound because the time has elapsed since he was shot. The fly set onto the wound and left the eggs, turned into larvae into the maggot. So the cat was fighting for the life from the bullet, then was fighting the economical constraints to the, then she was fighting the life from the abscess that she has developed. Sissy is still not out of the woods because it was toxic from the abscess, and all the wounds, got bacteria there, got contaminated. I'll ask people to pray for her because medically we can do so much, but
yeah.
to repair the lungs and nerves and other things is beyond doctor's control.
Well, folks, we're running this show. We run this show a lot, and hopefully, when you're seeing the show and it's airing, hopefully Sissy will be all right. But I know that you did the best you could. And once again, Doc, it's I've seen, folks, I've seen this guy act and do things in his office. It's just amazing. Anyway, that's why I love him. Is my adopted brother. We have a couple surgeries. We have a dog who had stones, so we're going to show this surgery that you did and explain what the people are looking at right now.
The dog, we are performing surgery on the dog. The dog it's a female, so, we can still call the dog. Had a difficulty going to bathroom or urinating and going in several frequencies, and sometime the urine will be pink. Actually, that pink urine is the blood. Came to my hospital, and again people had money constraints because it's a major surgery, and people don't think that emergency can strike any day, any time. They come to me after visiting some other veterinarians, ask if I could help. I said, of course, that's an animal, I have to help. Anyway, that's one part of it. The dog was severely anemic. Now, when the animal is anemic, the surgery is very challenging, because you have to give her the blood transfusion or do a procedure where the dog does not lose more blood. So I choose to do the surgical procedure with the CO2 laser. And I performed the surgical procedure with the CO2 laser. There was no hemorrhage, only just very few, some spots in and there. You will be watching on the television. So laser saved the life of dog because the dog did not bleed, and it was easier also. And we went there and removed silver dollar, a big one stone and one size of
that
a quarter.
big?
That big, yeah.
Silver dollar?
Silver dollar.
Oh,
yeah.
my gosh.
And the other one was as a quarter size. There were two large stones.
That's big.
Yeah. When the dog walked in, we had a history of a pink urine, and I felt the belly, and I felt those big stones. Then confirmed with the ultrasound the damage that the bladder has received for so long, and confirmed with the x-rays. And the surgery went very well, and that dog is very happy right now. Mm-hmm. And after 2 hours later, the dog is walking around, look like nothing happened to it. Well, when you perform a surgery with the laser, it's much easier on the animal, because it seals off the nerve endings, it seals off the lymphatics, it seals up the small blood. When the animal wakes up, the wound doesn't swell because the lymphatics are sealed off and doesn't feel as much pain. It's a very neat, and plus we can see exactly what tissue we are incising with that as you are watching on the television.
Could there have been something that could have prevented that from happening? Was it exercise or diet, or that maybe the
I can give you the number of causes for that. Some of the stones in the urinary bladder or kidney could be due to kidney disease. It could be due to genetics, could be the nutritions, or could be hereditary. There could be several causes for it. Infection or something. One time I removed a catheter was left over in the urinary bladder of a cat, and it has formed that much stone. If something is left in the urinary bladder, and it will form big stone. So there could be several causes for that. And what you can do, of course, we remove them, then we'll try to do the analysis of the stone. So what is the composition of the stone? And after seeing the composition of the stone, we put the proper diet to them.
Good. Now, the other procedure we're going to look at has to do with a bird, okay?
Yeah.
And now, what are we looking at now?
So ordinary person, when they will be looking at the bird, they will think that the legs are getting old, are getting scaly, or getting weird. But for us as a veterinarian, we know there is a problem, which is a very common problem. It's scaly-legged mites. These are the mites. It's a microscopic mite that live under the scale and live off the blood and serum of the bird. And it attacks the leg, or sometimes it attacks the beak area as well. And when the body reacts to it, it causes inflammation, and that inflammation turns into abnormal tissue, and the legs looks very thick and very scaly, as you will watch on the television. We confirm it by doing scrapings on those lesions and taking those scraping to the microscope and look under the microscope, and we 100% confirm that that is caused by the parasite, and the prognosis is good, because you treat them with the miticides. Medicine is available even over the counter. You can treat them. So that is the second procedure I'm going to show you. And the third one.
Now, the one that we're going to be, the next one we're looking at, folks, is a kitten. And what about this kitten?
The kitten apparently is very healthy and looks like there's nothing wrong with it, but sometimes such kittens are brought to me. They will say, my kitten was playing very fine, and all of a sudden, boom, they are like comatose. They don't know what's going on with them. Actually, there are some parasites. They are living off the food of the kittens. That the kitten is taking food, and the worms, they are eating all the nutrients away. And there's another parasite called coccidiosis. The oocysts of the coccidiosis that get into the linings of the intestine and damage the lining of the intestine. Then they develop a diarrhea. Lose the body protein, and once their threshold is passed, and all of a sudden you will see the animal boom get down, and they are ready to pass out. Now, because they have lost the nutrient value. They're sucked up all by the worms, and damage caused by the parasite, and the protein of the body, which is the fuel for the body, is all washed out, and the animal is collapsed. At that time, the treatment is very challenging. So before that thing happens, what you do routinely, take the stool sample of your kitten or puppies, or once a year with your pet, to the veterinarian. Before the disaster strikes, we were able to control, as you will see on the microscope. There are so many oocysts floating around, and the roundworm eggs. And again, there are certain parasites that could be zoonotic. Zoonotic means that they can get into the toddlers, they can get in the people with low immune system. So whenever you clean your pet's bathroom area, make sure you wash your hands pretty good, and try to keep the litter box away from the toddlers so they don't get into the feces.
Folks, Dr. Naya Kathio, Pittston Animal Hospital. Naya Kathio, Pittston Animal Hospital, 655-2412. We'll be back right after this. Welcome back to Pet's Best Friend, folks. Yes, we're bringing it back with my good, my friend who was my adopted brother, Dr. Naya Kathio, and at 655-2412. Well, Doctor, I'm excited about bringing the show back and educating people, and I think that's the whole purpose here. I think that on one of the shows, each show, we should have helpful tips, for different things that you encounter that maybe could help people. But in closing, what do you have to say?
Helpful tip I can tell you about my recent experience. People had medication left on the counter, and here comes the dog and chews up that plastic and swallows all the pills and becomes toxic from it. The good thing is the person was knowledgeable. He knew the dog took the pill and ran down to me. The dog's heart rate supposed to be 80 to 120. It was like 220. It was racing so fast because it had swallowed the thyroid pills into the system. We were able to save the dog and get the zinc pills out from the system.
Well, Doc, I'm really excited about having you doing the show again, and I know we're going to have a lot of fun doing it as usual, and I'm thrilled about it, and always wish you the best. And I want to thank you on behalf of a lot of people that you've done a lot of great things. And I know you don't like the acclimates, but the point is that you do a lot of good. And I think you should be thanked for that. And Ken Jackson, folks, did a beautiful article June the 4th in the Standard Speaker. You may go on the internet and watch it. But you can watch this show 24/7, ssptv.com. Hit shows, Pet's Best Friend. We'll see you next time.